On the Medical Watch, it is one of the most troubling yet misunderstood effects of war, post-traumatic stress disorder. Now a local doctor says he can block the effects and stop the torture for veterans and their families.
The sights, the sounds of war linger, even when soldiers come home.
You try to relax and you just can't really relax. And you're always tense. I started seeing shadows out of the corners of my eye.
It reminded him of the danger lurking all around in Baghdad.
When you started getting on the helicopters and the convoys, people taking pot shots at you, people blowing up IEDs.
One explosive device blew up and knocked Jason Brown out.
Disoriented for a while. My ears bled for quite a while, even after I got home. Some blood would seep out at night on the pillow. I would just feel nauseated, sick, tired all the time.
The 29-year-old Army reservist knew something was wrong, but there is no true diagnostic test for post-traumatic stress disorder. Still, experts say they can see something on functional MRI, the area of the brain most impacted.
People who have PTSD have an overactive, if you will, frontal lobe.
It's the place activated when we feel that fight-or-flight response. Yet for some reason in veterans, it stays in high gear.
Imagine being threatened at all times. It changes nerve function, so that what happens with this constant state of anxiety is actually that you get kind of sprouting of new neurons.
And that can cause physical as well as emotional pain. That's why pain management specialist Dr. Eugene Lipov is using a treatment typically applied for pain, but this time it's changing the brain.
Well, what we found is that a stellate ganglion block, which is an old procedure for pain in the arm, works on post-traumatic stress syndrome, and it works quickly. The trauma happens, nerve growth factor comes out, nerve growth factor goes here, and then the sprouting happens, secondary to the trauma. When you do the block, it turns off the NGF. So NGF goes away, and the sprouts go away, and now he's back to normal.
Is he? PTSD expert Dr. Joseph Yunt has been counseling soldiers and veterans for more than 25 years at the Jesse Brown VA Medical Center.
Blocking or any attempt to promote forgetting or suppression, repression of this stuff, that's not going to work. It'll just force it into a corner where it's going to act up later.
At first, when he first told me about it, I was kind of concerned about it, and I was really skeptical. I didn't, because I had seen everything that the VA had done with like talk therapy and medicine and everything, and none of that really seemed to work. So I didn't see how this like little miracle shot was going to work. But then after I had it, I felt so much better, and I believe in it now.
Dr. Lipov has successfully treated 5 patients and is now hoping to get funding to do more widespread research to help our servicemen and women before it's too late. On the Medical Watch, Dina Baer, WGN.